Subscribe for daily quizzes and let me know how many you got correct today. Here's some emergency medicine trivia. What scale is used to measure the severity of a burn? A. Bristol scale, or B. Glasgow Coma Scale, or C. Lund and Browder, or D. Merck Index? The correct answer is C. Lund and Browder. What is the initial treatment for a sprain? A. Heat application, or B. Surgery required, or C. Rest, ice, compression, elevation, or D. Quick stretching? The correct answer is C. Rest, ice, compression, elevation. What is the term for a swollen or inflamed appendix? A. Appendicitis, or B. Gastritis, or C. Appendectomy, or D. Colitis? The correct answer is A. Appendicitis. What is used to assess a patient's consciousness level? A. Mini mental status, or B. Brain function test, or C. Neurological exam, or D. Glasgow Coma Scale? The correct answer is D. Glasgow Coma Scale. What vein is often chosen for IV access? A. Median cubital vein, or B. Tibial vein, or C. Jugular vein, or carotid vein? The correct answer is A. Median cubital vein. What is the purpose of a tourniquet? A. Reduce swelling, or B. Control severe bleeding, or C. Prevent infections, or D. Stop bone fractures? The correct answer is B. Control severe bleeding. What is a common cause of hypothermia? A. Prolonged exposure to cold, or B. High humidity levels, or C. Increased body temperature, or D. Rapid muscle contraction? The correct answer is A. Prolonged exposure to cold. What medical professionals perform triage? A. Nurses, or B. Emergency medical technicians, or C. Paramedics, or D. Surgeons? The correct answer is B. Emergency medical technicians. What is the name of the condition involving skin and fat inflammation? A. Eczema, or B. Dermatitis, or C. Cellulitis, or D. Psoriasis? The correct answer is C. Cellulitis. What is the first aid treatment for choking? A. CPR, or B. Back blows, or C. Ice pack, or D. Heimlich maneuver? The correct answer is B. Back blows. What condition occurs after exposure to toxic substances? A. Infection, or B. Dehydration, or C. Allergy, or D. Poisoning? The correct answer is D. Poisoning. What type of shock is caused by severe blood loss? A. Anaphylactic shock, or B. Hypovolemic shock, or C. Septic shock, or D. Cardiogenic shock? The correct answer is B. Hypovolemic shock. What infection is characterized by fever and sore throat? A. Flu virus, or B. Common cold, or C. Strep throat, or D. Ear infection? The correct answer is C. Strep throat. What is often the first step in treating a wound? A. Cleaning, or B. Using ointment, or C. Dressing the wound, or D. Applying ice? The correct answer is A. Cleaning. What is the term for a narrowly constricted airway? A. Bronchospasm, or B. Airway blockage, or C. Lung inflammation, or D. Asthma attack? The correct answer is A. Bronchospasm. What is the primary concern in anaphylaxis? A. Skin rash, or B. Cardiac arrest, or C. Airway obstruction, or D. Blood pressure drop? The correct answer is C. Airway obstruction. What is the term for a temporary loss of consciousness? A. Blackout moment, or syncope, or C. Dizziness, or D. Fainting spell? The correct answer is B, syncope. What kind of imaging is often used in trauma cases? A, X-ray or CT scan, or C, ultrasound, or D, MRI? The correct answer is B, CT scan. What is the medical term for a broken bone? A, crack or breakage, or C, fracture, or D, snap? The correct answer is C, fracture. What is administered in cases of heroin overdose? A, cocaine, or B, morphine, or C, methadone, or D, naloxone? The correct answer is D, naloxone. What condition can prevent blood from flowing properly? A, anemia, or B, thrombosis, or C, diabetes, or D, asthma? The correct answer is B, thrombosis. What is the recommended body position for shock? A, standing position, or B, supine, or C, lying face down, or D, sitting upright? The correct answer is B, supine. What type of bleeding involves arteries? A, capillary bleeding, or B, venous bleeding, or C, internal bleeding, or D, arterial bleeding? The correct answer is D, arterial bleeding. What is the role of an emergency physician? A, provide immediate care, or B, diagnose chronic illnesses, or C, perform surgeries, or D, prescribe long-term medications? The correct answer is A, provide immediate care. What is the primary cause of burns? A, electric shock, or B, chemical reactions, or C, cold weather, or D, heat exposure? The correct answer is D, heat exposure. What is used to stabilize a fractured limb? A, brace or splint, C, bandage, or D, crutch? The correct answer is B, splint. What is applied to a sprain during initial treatment? A, heat pad or massage therapy, or C, ice pack, or D, bandage wrap? The correct answer is C, ice pack. What is the primary risk factor for myocardial infarction? A, smoking cessation, or B, coronary artery disease, or C, regular exercise, or D, high cholesterol? The correct answer is B, coronary artery disease. What is the first action during a seizure? A, ensure safety, or B, check the pulse, or C, call for help, or D, administer medication? The correct answer is A, ensure safety. What is a symptom of a concussion? A, nausea, or B, headache, or C, dizziness, or D, vision loss? The correct answer is B, headache. What term describes the absence of breath? A, dyspnea, or B, hypoxia, or C, asphyxia, apnea? The correct answer is D, apnea. What is the term for the body's response to injury? A, immune reaction, or B, shock syndrome, or C, inflammatory response, or D, healing process? The correct answer is C, inflammatory response. What is a risk factor for stroke? A, low blood sugar, or B, high blood pressure, or C, high cholesterol, or D, regular exercise? The correct answer is B, high blood pressure. What is measured using a sphygmomanometer? A, blood pressure, or B, respiratory rate, or C, body temperature, or D, heart rate? The correct answer is A, blood pressure. What condition is treated with insulin? A, heart disease, or B, asthma, or C, diabetes, or D, arthritis? The correct answer is C, diabetes. What should be used to manage a nosebleed? A. Apply ice pack, or B. Pinch nostrils, or C. Use cough syrup, or D. Tilt head back. The correct answer is B. Pinch nostrils. What device monitors heart activity? A. ECG, or B. Heart monitor, or C. Pulse meter, or D. Blood scanner. The correct answer is A. ECG. What is an essential skill for managing trauma? A. Assessment, or B. Working overtime, or C. Financial planning, or D. Meditation techniques. The correct answer is A. Assessment. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.